So, when you hear the term radiation therapy, what's the first thing that pops into your head? For a lot of us, it's a bit of a mystery. But today, we're going to shine a light on what is genuinely one of the most precise and incredible tools in all of modern medicine. Let's get into it.
Here's what we're going to cover. We'll start with this idea of a medical spotlight. Then we'll dive into how it targets a cell's blueprint, its huge role in cancer care, some really surprising uses you probably haven't heard of, and finally, how every single treatment plan is built just for you.
All right, let's kick things off with a really simple but honestly a perfect way to think about this technology. Yeah, just picture that, an invisible, totally painless medical spotlight. And we're not talking about a big, broad floodlight here. This is like a laser pointer. It's all about extreme accuracy, hitting only the cells that need to be treated. It's a game changer. So when you boil it all down, that's what it is. We're using these focused beams of energy to basically tell misbehaving cells, hey, stop what you're doing. It's a pretty straightforward idea with some incredibly sophisticated science behind it. Okay, so how does this invisible spotlight actually get the job done? Well, the secret lies in going right to the source, to the very instruction manual inside every single cell. Right, DNA. You've heard of it, of course. It's the blueprint, the code that tells each cell how to grow, how to fix itself, and when to divide. And that blueprint is the exact target of radiation therapy.
And the way it does this is just fascinating. It's a two-pronged attack. First, you've got direct hits, where the energy beams literally break the strands of DNA, scrambling the instructions. But there are also indirect hits. The radiation zaps water molecules in the cell, creating these tiny destructive particles called free radicals that cause even more damage. It's a brilliant 1-2 punch.
Now, you're probably thinking, okay, but what about my healthy cells? And that is the critical question. Here's the difference. Your healthy cells are amazing at repairing DNA damage. They have these robust little repair crews. Cancer cells, they're terrible at it. So the therapy is designed to exploit that weakness, giving your healthy tissue time to recover while the abnormal cells just can't keep up. So let's move on to the place where the science is most famous, in the fight against cancer. And it really truly is a cornerstone. I mean, for millions of people around the world, this precise spotlight is a absolutely fundamental part of their treatment journey, and it's used in so many different strategic ways. It's not just one tool, it's like a whole toolkit. Sometimes it's the primary treatment, the one that's meant to cure the cancer all on its own. Other times it's a team player, working alongside surgery or chemo. It can go in before an operation to shrink a tumor and make it easier to remove, or it can come in after to clean up any microscopic cells left behind. And so importantly, it can be used just to relieve symptoms and make life better. But hang on, because this is where the story takes a really unexpected turn. This technology isn't just for cancer, not even close. Just look at this list. It's kind of amazing, right? We're talking about treating non-cancerous brain tumors, tangled blood vessels in the brain, painful nerve conditions, even those thick, raised scars called keloids. It can stop unwanted bone from growing after an injury, and yeah, you're seeing that last one correctly. It's even used for things like arthritis and tennis elbow. Wild. So how on earth does it treat something like tennis elbow? Well, it uses a completely different playbook called low-dose radiation therapy, or LDRT. The goal here isn't to destroy cells at all, it's to calm them down.
I love this analogy. Think of it this way. Standard radiation therapy is trying to stop the music by breaking the speakers. Low-dose RT, on the other hand, just tunes down the volume. It uses a tiny, tiny amount of radiation to tell the immune system to chill out, which reduces inflammation and pain. It's a completely different philosophy. And that brings us to our final, and honestly maybe the most important point of all, how this powerful technology is tailored for every single person. Believe it or not, in some cases, all it takes is a single high-precision treatment session, and that's it. But for most treatments that take longer, the total dose is carefully broken up into these smaller daily doses called fractions. And this isn't just for scheduling. It's a crucial safety feature. It allows the treatment to hit the unhealthy cells day after day, while giving your healthy cells that vital time they need to repair and recover in between.
It all comes down to this. A treatment plan is exactly that, your plan. It's designed by a whole team of experts who look at your specific condition, where it is, and your overall health. There is absolutely no one-size-fits-all approach here. And that is really the key takeaway. This is a technology with an immense range. It can be powerful enough to cure cancer, but it can also be gentle enough to just quiet down inflammation. And it is always, always meticulously tailored to the individual.
So, as we get better and better at understanding how our cells work, it really makes you wonder, doesn't it? With a tool this precise, a tool that can interact with our biology with such amazing accuracy, what new doors is it going to open? What other conditions could this incredible medical spotlight one day help us treat?